Hi, Trupti. It's lovely to see you. We met a few months ago, and I was really interested to hear you talking enthusiastically about evaluation because I know evaluation is something that lots of our members find quite challenging and frustrating, and finding ways to make the process of evaluating fit the nuance of practice and the reality of what we're all experiencing. So I thought it might be useful for us to have just a chat about how you approach it and see where that takes us. But first of all, if you wouldn't mind just saying a few words about your organisation and where you're coming from with this work, that'd be great.
Thank you, Victoria. Thank you for inviting me to chat. My name's Trupti. I work for an organisation called Deep Black. We've been around for quite a while, almost 14 years. And so our work is about using creativity to support mental health, mostly young people's mental health. We're doing a lot of work in schools. We have a significant chunk of our work currently being commissioned by local mental health trusts. And so evaluation is really important for us because we work with clinicians who kind of expect us to be able to provide an evidence base for what we're doing. And initially that was really challenging for us because we really struggled to understand how we show the thing that we're really passionate about, which is the distance travelled by a young person. How do you quantify that? How do you measure that? So we're very fortunate to work alongside Dr. Nick Barnes, who's an associate professor at UCL, and he holds the big kind of framework of our evaluation, and every year we'll kind of independently evaluate our work and our impact and our contribution to outcomes for young people. But alongside that, we also are really interested in learning and finding out from young people how our work sits. We co-create a lot of our work, and so we are really happy to have conversations with young people really openly and honestly about what works for them, what they find useful, what they don't, and respond to that accordingly. So we use evaluation as a way for us to think about how we co-create work and how we think about what we do next. It's really important. I can't stress how important it is.
So there's sort of two arms to it. There's the bit that's about demonstrating value to the people who are commissioning you, and then there's the bit about improving the practice from your perspective. And do you find that those two things tie together, or do they remain quite sort of separate streams?
It feels like different layers of the same conversation. So sometimes the data that commissioners are looking for is quite basic, actually. Sometimes it's around numbers of people participating and geographical locations, because of course we want to show that we're spending money in the areas that we're targeting. And so that feels for us quite a basic level of information. The stuff which we're more interested in, I guess, is the more qualitative data, which is much harder to put into, if you like, a clinical framework. But that's the stuff that makes it possible for us to respond more directly to the young people that we're working with, and for us to frame our work in a way that is much more closely responding to their needs.
And does that qualitative work, does that also get fed back to the commissioners?
Absolutely.
Yeah.
So it does, and maybe that's not the bit that is the most meaningful for them.
That's interesting, isn't it?
So it's part of all that we present back, and quite often what we're being asked to do is scale up. So 3 years ago we were working in one school. This year we're working in 5 with 3 primary schools, and next year we've kind of got a dozen schools that we're in, with many more primary schools interested. And so by kind of getting organised in terms of how we're showing our value to the service, kind of really helps us have a greater reach, and helps us be mindful of, as a small organisation, how we can stretch and be accessible to more people.
And the relationship with UCL, how did that come about? If it's all right to ask that.
Of course. We met Nick in Harringay. We co-produced a piece of work together, and it was a piece of work. It was a partnership piece of work where we were the creative agency, with working in partnership with a local school, with Parkview School, working with a media agency who made a film about the project, and working with the local mental health trust. And it was really through Nick's advocacy and his very brilliant skills at translating what we do in the voluntary sector and in the arts into the language of kind of the mental health trust that kind of has really enabled us to kind of get a footing in that world. And it felt really in the early years that we really needed a translator, because I felt that we were speaking different languages. It felt really, really important for us to have somebody who understood our work and was able to talk about it in a way which we simply didn't have the skills to be able to kind of frame it and understand it. And he had a foot in both camps.
That's really interesting, that question about language and translation and confidence. And how do you feel like that relationship has sort of built your confidence in other ways in the organisation?
Absolutely. We continue to work with Nick. He's a rather brilliant individual. So it's really, really amazing to have such a well-respected clinician firmly on our side. And that in itself has kind of opened doors that otherwise we would just simply be knocking on. So that really helps our confidence and our credibility to be taken seriously amongst kind of very serious heavyweight clinicians, which for us, I have to be honest, felt really intimidating in the early days. And over time, what he's sort of been able to nurture, which he does in all the voluntary sector works that he does. Nick is one of those people who has his fingers in lots of different pies. And he's able to nurture those organisations to kind of grow their confidence, to find their feet, because he is such an unwavering advocate of a different way of working. And so he's a real champion of bringing young people's voices into the NHS, where sadly sometimes they are not very well represented or heard. And arts is a great way of doing that. And so with our work with him, we've really grown our skills in how we present our work and what makes sense for the clinicians who commission it.
And I was thinking about what you said about the sort of qualitative side of things, and the, hearing from young people about what works for them, what doesn't work for them. Is there a place in there also for a kind of reflective practice on the part of the facilitators and as an organisation? And
yes, of course. By kind of having conversations with young people, with all of our stakeholders, including commissioners, it also gives us a framework to think about what we're doing and look at what we've enjoyed, which bits are kind of the parts of our work that really nourish us, which parts we find particularly challenging, which areas we kind of need to develop skills around. And because we're a creative organisation and respond to the different skills of the team and the passions of the team, it enables us to really flex with kind of whichever art form we're working with, and so that's really important, and is also part of our evaluation process.
Yeah, I think it's something we've been talking about for a while, that sometimes in our efforts to try to get a critique of our work, or to be objective in a way, we sometimes miss out the very valuable knowledge that we have as practitioners, and that sort of degrade that slightly. And it feels really important that gets included overtly in evaluation. There is so much value in there from as you say, the sort of commitment and experience and all of that. All of that knowledge that people hold, that it can sometimes be difficult to sort of remember that your own expertise in it, in a way, and find a way of talking about that.
Yeah.
That's great. That's really helpful. I suppose that it feels like the key thing really is about this partnership and how that has sort of extended the possibilities for you. And working with a university does seem to kind of to give you a bit of sort of infrastructural help in a way, or another organizational culture there.
Yeah, I think it's really important to have partners, all sorts of partners who have skills that complement your own. And we've really learnt the strength of that, because without kind of the partnerships that we have around us, whether they're in the mental health trust or whether they're in schools, because we kind of build long-term relationships with people, we wouldn't be able to do as much as we are able to do without kind of people kind of chipping in from their perspectives. We're able to be much more robust in responding to keeping young people at the centre of our practice. And that's really important, not only for the young people, but also for our growth as a creative organisation. That's really kind of key. We can't do it on our own. We wouldn't have survived by ourselves, particularly over the challenges of the last couple of years. We really have needed to lean into people to help and support and help us think about areas that are really hard and that are really challenging.
And on that, how has your approach to evaluation changed through the pandemic?
It's been more difficult in some respects because it's much harder to. There have been loads of situations where we would have kind of done a 5-minute space at the end of a workshop and given people a piece of paper, which is kind of a really quick way to capture feedback. And kind of emailing those things is nowhere near as effective because we don't get the same kind of responses. It's also really hard to gauge where people are at. So one of the things we would do in a physical workshop is to have kind of moments in the work where we do physical exercises to get immediate feedback. Is this working? Is this landing? Are you with us? Kind of. We would have quite physical exercises that kind of show us and let us know where people are at with what we're doing. But doing that on a online platform is much more challenging. So I think our feedback has been a bit more inconsistent online. I think it's just been more difficult. But at the same time, it's also offered us opportunities that we would not even have conceived of. And we've kind of approached working online as a creative challenge. And so we've kind of racked our brains and tried to find how we can adapt the games that we would use in a room to work online. And so, it's kind of given us a different platform. And what the online thing, of course, enables is allowing lots of people to connect from wherever they are. So that's kind of opened new possibilities. And so, that's allowed for some things which we might not have stumbled across. But I'm not going to lie, it's been really difficult too.
Yeah, I mean, we gathered quite a lot of case studies at in the sort of earlier part of lockdown, and the difficulty of evaluation was a really key theme. And in some cases, it was about the transition to online. In other cases, it was about the fact that you're working much more through a second person. So it might be that our members were working with a social worker, for example, and then hoping that they would be able to do the evaluation. But of course, nobody's got the capacity. So I think it's been really difficult for people. But I think there's so much value in our own understanding and responses to the work that can, in these sort of challenging times, that can fill some of those gaps, just the reflections that we have ourselves.
Yeah, we had a couple of creative projects that were interrupted by the pandemic. So we had started a photography project in 2 schools before the lockdown in schools happened. and then weren't able to complete those projects until the following academic year. So it was about 9 months, which actually is a really long period of time in a young person's life, and it's a huge period of time with all of the other experiences that happened in between. And we found that it was really hard to try and make sense of what that journey looked like. So the evaluation slightly didn't make any sense. Yeah. And so I think there's also kind of a question about how useful is it at this point? Because I think we can kind of keep trying to do things in the same way because we've always done them in the same way. And I think the lesson for us in that experience was just to let it go and allow that piece of work to be what it was for those people who were still able to engage, knowing that the lives of those people had been massively fragmented through the pandemic.
Yeah, that feels really important. Also, to just not expect that we can sustain the same practices. Exactly. Just a practical question. You were talking about some of the exercises that you use, and we're often asked about what frame, to recommend a particular evaluation framework, or which I'm a bit resistant about, although we have got a lot of frameworks on our website. I'll include the link. But do you use any sort of set frameworks for your work, or do you adapt as you go?
We, the one that we've agreed for the NHS with our work in schools is the Children Outcomes Rating Scale, which is a really simple, super quick, really straightforward tool that offers a very subjective experience from the young person's perspective, which is what we're all about. We really want to know what that piece of work has felt like for the young person in it, and so we've kind of stuck with that as a tool. And I know there are others out there, and maybe in time we will add, but currently that's kind of our key sort of one that we use with the NHS. And then we use our own kind of evaluation forms and our own feedback forms, some of which give us kind of quantitative data, so we can kind of go out of that give us some kind of statistical information. So we can kind of say 85% of participants really love this workshop because they rated it kind of 1 to 5. So really simple. We try and make evaluation as simple and straightforward as we can. And actually one of the things we discovered through the pandemic was kind of the joy of lots of online tools that do that data capture and kind of take out the pain of the admin of kind of typing those things up because they're gathered.
Like polling and things like that you can, yeah, those have been really helpful, I think. And keep it quick, and you can do them in the moment as well. So you haven't got that, as you were saying earlier, that thing of having to email people afterwards when they've moved on to something else. And yeah, thanks. That's been really helpful. Anything else that we've missed that you would like to reflect on?
Yeah, I think there's, for us, one of the things, we sort of touched on it, that's been really helpful for us is to really think about our own views. And so sometimes we can be really subjective. And because we're qualified experienced practitioners, actually our own views do add weight. We do have a view, we do have a perspective, and we do have a sense of what that history of our work has been. And so often I think that it took us a while to recognise the value of that, I think. And that's been a bit of a journey for us to add in kind of, we do these external things, we have kind of Nick's very kind of bird's eye perspective with kind of the bigger picture and the context. We have the young people's perspectives, and it took us a while to work out that it's really important that we add our own perspective too, and that's valid.
That's so great to hear. I think, it's been identified as a gap in the research as well, that there is this sort of absence of the practitioner's perspective very often. And it's, as you say, it's so important to recognise that expertise and sense of history and development and process and progress. And yeah, that's great. Thanks so much, Trupti. That was really interesting. And yeah, I look forward to speaking again soon.
Great. Thank you so much.